Good afternoon. My name is Andrea Hernandez. I'm one of the psychiatrists here at the clinic.
Hi, my name is Jimmy Pleasance. I'm the practice manager at Cognitive Psychiatry of Chapel Hill.
Hi, I'm Shanti Bhattacharya. I'm one of the psychiatrists here at Cognitive Psychiatry.
Good morning. My name is Jessica. I'm the therapist here at CPCH.
Hey, I'm Tony. I'm the patient care coordinator here.
Hey, I'm Dr. Baird. I'm one of the psychiatrists here.
Hi, my name is Dr. Jenny Byrne. I'm an adult psychiatrist. I am the owner here at Cognitive Psychiatry of Chapel Hill, and I'm also a psychiatrist seeing patients. The practice opened in 2010, so as of the time of this video, we've been open for 9 years.
So first and foremost, I see my role here at Cognitive Psychiatry as trying to provide the best treatment I can to my patients, but outside of what happens in the room in that respect, I guess sometimes I serve as medical director when Dr. Burns is out of the office. Also try to take on some of the admin roles on my own, potentially more so than I have in the past in terms of just dealing with patient emails and calls and whatnot directly, to try to work within the team format. And maybe just pick up some other things here and there, including providing support to other providers where needed and whatnot.
I work here 3 days a week. I see patients starting from age 18 and above. I do like to see people struggling with different kinds of mental health disorders and who are in different stages of their life.
Mostly, I deal with prior authorization for patients, prescription refills requests, answer different patients' questions, rescheduling, also deal with reception, checking patients in. So my job is pretty spread out. I am also acting office manager when my office manager is out of the office.
My role involves working with all of our clients as well as the clinicians here to make sure that everybody has a great experience and everybody's taken care of.
My role is to provide therapy for all of our patients, whether they're doing medication management with one of our psychiatrists, or if they specifically come in here for therapy services, I'm able to help them as well. I enjoy working with individuals, couples, and families. I'm a marriage and family therapist.
My role is to see patients. Usually my patients are 18 to 65 years old, with a variety of mental health disorders. I also do TMS at Greenbrook, which is right across our office. So most of the patients that receive TMS in our office will see me there at Greenbrook for TMS.
The most fun part about my job is to see people get better. That's really the most rewarding part about being a psychiatrist, and that really keeps me going. It's really amazing to see a person to go from struggling to do the very basics in life to becoming the most functional version of themselves that they can be. That is really, really cool to see.
What is most fun about my jobs entail me to interact with all the patients at all times, which makes it exciting for me, which I've been great at, I think, and done a great job in the past 6 years that I've been here.
The most fun about my job is to really be social and work with the patients as well as the other providers here. I really find it engaging and uplifting to meet with these clients who are very motivated to feel better and to get better faster, which is our motif of the year. And I really enjoy coming to work and feeling like these people that I work with really want to better themselves and their lives, and it encourages me to want to do the same and to meet the goals that I have for myself and to try to better myself as well.
One of the things I enjoy most about working here at Cognitive Psychiatry of Chapel Hill is that we really get to see patients and staff members grow and change over time. So having been here for almost 10 years, I've really gotten to know some people and see them through all sorts of life stages. So I've had people I've seen start here as a student, and then they've gone on to school or jobs or get married or have children, and just to be with them on their journey is one of the most fun things I get to do.
A great patient for us is again somebody that is highly motivated and invested and wants to work and wants to get better. So those are usually the patients that we see here, and the patients that actually do get better, and that you can see them from, you can see the big difference when they respond to treatment, and how they are happy, how they are pleased with what they have achieved, they have overcome a crisis. So those are the type of patients that are a good fit for us.
I think really it's what the whole support and admin staff puts into it, as well as the providers, of course. I think there's a really good teamwork aspect here, and everyone's looking out for the best interest of the patient as soon as they walk through the doors. So that's one thing that I've really valued here versus other clinics I've worked at, in the sense of it seems like everyone, I know it's cliche, but truly does care and wants everyone to have both a great experience, I think, from the office and admin staff perspective, but also have good clinical outcomes from the provider perspective, and again, hopefully get everyone living the life that they want to live and finding meaningfulness and enjoyment on a day-to-day basis.
I'd say that the first thing would be great providers, great clinicians that have your best interest at heart. I would say the second thing would be the non-clinic-y feel to our practice. We've got some great people here and a really relaxed environment that can make you feel comfortable as you're coming in. I know each appointment is, in addition to the initial appointment, can be very, very stressful. So we've done all we can to really make it as comfortable as possible for you. The other thing that's great about being a client here at Cognitive Psychiatry of Chapel Hill is the fact that you get to interact with myself, with Tony, with our admin team. You've got somebody that's going to answer the phones. You've got somebody that's going to talk to you about anything that's needed. And we're always here for you. So there's always somebody that's just a phone call or an email away. And I would say those would be the main reasons to be a client here at Cognitive Psychiatry. Thanks.
So in terms of what kind of patient is a good fit for us, or why anybody watching this video might want to join us here at the practice, I really started this practice in response to kind of how it was like for me to be a patient in other doctors' offices and to deal with a lot of the frustrations that I personally experienced. So I've been very thoughtful over time, and as we've grown, the staff here, the other providers, all have the same vision, which is that we want to treat you the way that we want to be treated ourselves. So what does that mean? That could mean different things. For me, one of the main things I hated about going to doctors was waiting. So I would get very frustrated. I would make appointments 8 a.m. in the morning, hoping to be the first person there, and I'd get there and they'd say, well, it's a 20-minute wait. And I was like, well, I scheduled the first appointment of the day. How could you possibly be behind? So for me, time is one of the most valuable things, if not the most valuable thing I have. So wasting time, or at least, not being able to predict the time has been really difficult. So if you are someone like me and your time is valuable and you don't want to waste time waiting and getting impatient and frustrated, this is a great place, because we all focus on being on time for our patients. Another thing that frustrated me about providers was it was difficult to get the right information at the time that I needed it. So I would call, and maybe I'd have someone on the phone who was really nice, but they couldn't really help me, or I'd have to leave a message and someone would have to get back to me, or I'd want to be able to send an email, but then they'd say, well, we can't accept emails here. And so it was hard for me to communicate with them when I needed to, like when it was convenient or important to me. So here at Cognitive Psychiatry, we've designed the systems to make sure that everybody has access to their doctor when they need it. So, you can contact us via phone, via email. There's going to be someone here who will pick up and respond to you quickly and efficiently and know how to help you with your problem. And that's really, really important to me. And so that's something, if it's important to you, I think you would really like about us here. And then I think finally, the other thing that is important to me, and I know other people, is that the space we're in, the environment that we're in, is a welcoming, warm environment that's professional and kind of modern. It feels comfortable if you like that. So if you're the kind of person that wants something, that's very homey, like in somebody's private home or something, this is not going to be a good fit for you. But if you're someone that likes to be somewhere that's kind of an open, airy, modern, warm environment, that's really what we strive for here. So you can see me, I'm looking out the back window. We have nice views here. That's important to me, and maybe that's something that's not important to you. But the environment here, just to make you feel really warm and welcome before you even talk to anybody, that's something that I think we do well.